Up to 16% of people over the age of 55 suffer from peripheral artery disease, or PAD. Risk factors for the condition include diabetes, smoking, older age, and atherosclerosis in any arterial blood vessel. PAD is a progressive condition caused by the formation of atherosclerotic plaques in the peripheral arteries, reducing blood flow and, in some cases, causing pain. The rupture of one of these plaques triggers platelet activation and factor Xa-mediated thrombin generation, leading to the formation of a blood clot, a process known as atherothrombosis. This further limits, or may even completely block, blood flow through the artery, causing symptoms to worsen. Vascular obstruction may cause limb ischemia, which, in the most severe cases, can lead to limb amputation. Importantly, PAD is frequently asymptomatic. More than half of patients undergoing major amputation for critical limb ischemia may have had no symptoms of ischemia as little as 6 months earlier. In some high-risk cases, revascularization is recommended to relieve the ischemia. This involves using a stent to manually widen the artery and restore blood flow. Over 60% of patients with PAD also have atherosclerotic plaques in the coronary arteries of the heart or in the arteries supplying oxygen to the brain. Patients with PAD are therefore not only at risk of critical limb ischemia, but also of other thrombotic events, such as myocardial infarction or stroke. Arterial blood clots are rich in platelets. Guidelines recommend that patients with PAD receive antiplatelet agents and make certain lifestyle changes to reduce their atherothrombotic risk. Despite this, patients remain at high risk of thrombotic events. In one clinical trial, nearly 1 in 10 patients with previous PAD had a myocardial infarction, stroke, or died of cardiovascular causes, despite receiving acetylsalicylic acid. To further reduce this risk, clinical trials are investigating optimal treatment strategies in patients with acute limb ischemia or stable PAD. The results of these studies hold great interest for physicians and patients alike.